Okay, good afternoon, everybody. It's great to see you all here. And we're getting our program started here. And so it's my honor to introduce to you to get us kicked off, Rebecca Coakley, Program Officer at U.S. Disability Rights here at the Ford Foundation.
Thank you so much, Michael. It's a pleasure to be here with all of you today. Hello, my name is Rebecca Coakley. I'm the U.S. Disability Rights Program Officer here at the Ford Foundation. I wish I could be there with all of you, but I am zooming in from New Mexico, where I'm at a convening focused on the care economy, something that I know is very dear and near and dear and also critically important to both aging and disability communities. I want to actually take a moment and do something that I do as a point of order every day that I work at the Ford Foundation. I want to welcome all the disabled folks who have joined us, either remotely or in person, whether you've had your disability your entire life or it's a new diagnosis and a new reality. Welcome. Our community and our movement are infinitely strengthened by your presence, whether or not it's safe for you to disclose personally or professionally. We see you and are thrilled that you've joined us today. It is so exciting to see the American Society for Aging's Generations Journal curate an issue focused on the impact of ageism and ableism on the LGBT and other diverse communities. Kudos to Michael and the team from SAGE for working so hard on this event and working so hard to pull together articles for the journal. The issues at the nexus of disability and aging are complicated, which is what makes conversations like the one we're having today so important. When I worked at the Administration on Community Living in the Obama administration, it took us over a year to develop a mission statement because the aging community did not like the term empower, because it implied that they needed to be given power, which they already had. And the disability community did not like the term enable, because it implied that we were unable to do things. We are in fact able, we just require accommodations. The reality is, though, that our two communities desperately need to acknowledge that the goal is not independence, because no one is truly independent, but interdependence, which in itself is a core value of the disability justice movement. The disability rights movement at this moment is largely experiencing for the first time what it means to age in public. As the elders who are responsible for the Section 504 sit-ins, the longest federal occupation of a building in US history, and our mothers and fathers of the ADA, they're all getting older. And I remember asking them what their elders were like. And Judy Human, to her credit, said, "I don't know, Rebecca. They were locked in basements, institutionalized in places like Willowbrook. They didn't have the right to grow old surrounded by family and community. They aged in isolation." Today's conversation is not going to be a one-time thing, but rather the opportunity for a much larger, much longer conversation. Our panelists will discuss how structural ageism and ableism impact diverse older adult communities, public policy and legal strategy, organizational equity strategy, and human-centered design, among other subjects. And thank you so much for joining us today. And now I am more than thrilled to turn this conversation over to Michael. Take it away.
Okay. Thank you, Rebecca. And as folks know, we're here today for a conversation about the structures of ageism and ableism at the intersections. From analysis to community action. And that being the case, I think it's very appropriate to kick off the next phase of our discussion by introducing Rhonda Schwartz. Rhonda joined the Administration for Community Living in 2016 and has served as a regional administrator for ACL since 2019. Rhonda currently is the regional administrator for Region 2, which includes New Jersey, New York, Puerto Rico, and the U.S. Virgin Islands. And Rhonda has a long and distinguished career. And of course, ACL, literally by structure, stands at the intersections of ageism and ableism. And we're thrilled, Rhonda, to welcome you up to give us some remarks for a few minutes.
I'm a little short here. Okay, there we go. Thank you, Michael, and thanks to the Ford Foundation for hosting us today. Hello, everyone. It's an honor to be here today to talk to you about our shared goals and priorities. Allison Barkoff, our leader at the Administration for Community Living, really wanted to be here, as today's topic is incredibly important to her. But as you may have seen, many new regulations, including important disability and aging rules, are coming to fruition right now, and unfortunately, Allison needed to stay in the Capitol. For those of you not familiar, I want to share a little bit about the Administration for Community Living, or ACL for short. ACL is an agency in the U.S. Department of Health and Human Services. Our mission is to ensure that everybody, regardless of age, disability, or level of support need, can live in and fully participate in their communities. Our agency was created based on the common interests of older adults and people with disabilities because studies have shown they overwhelmingly want to live in their own homes and communities, and many need supports to do so. We fund 20,000 community-based disability and aging organizations in neighborhoods across all states and territories. These organizations provide and connect people with the community living programs that make our mission a reality. We also serve as the advisor to the HHS Secretary and other federal agencies on disability and aging policy, and we advocate within the federal government to ensure that the interests of older adults and people with disabilities have a seat at the table on policies that impact them. We know both older adults and people with disabilities too often face barriers, lack of access to community services, and stereotypes and discrimination, ageism and ableism that interfere with their ability to achieve their goals. Our agency strongly believes in equity and recognizes the additional barriers and discrimination faced by people who are multiply marginalized, including people with disabilities and older adults who are LGBTQ+, or from communities of color, live in rural areas, or do not speak English as their first language. We stand with cross-disability and aging coalitions like Care Can't Wait and Act on Raise, and we applaud efforts like those SAGE is undertaking to forge ever stronger unions among aging and disability advocates. We can achieve so much when we work together to eliminate stereotypes and discrimination and work to remove barriers to accessing healthcare, housing, and other critical community services. At ACL, we're putting an intentional focus on the common issues facing the disability and aging communities and spotlighting ways that we can combat the ableism and ageism that too many people face. For example, we have focused on the fact that people with disabilities become older adults, and many older adults age into disabilities. That's why our recent updates to the Older Americans Act include disabled older adults as a priority population. And we've included a focus on aging and into disability in our work leading the Federal Interagency Coordinating Committee on Healthy Aging and Age-Friendly Communities. HHS has also prioritized strengthening the anti-discrimination tools we have to fight against ageism and ableism. Last week, Allison Barkoff was on stage in Washington with HHS Secretary Becerra and others to announce the release of the final updated regulations to Section 504 of the of the Rehabilitation Act, which prohibits discrimination based on disability. And guess what? More than half of older adults meet the law's definition of disability, even if they don't think of themselves that way. Among other things, the new Section 504 rule will prohibit medical treatment decisions based on bias and stereotypes, require doctors' offices, medical equipment, websites, kiosks, and apps to be accessible, and strengthen the requirement that people, allergies. People receive services in the community instead of being forced into institutions. HHS also just released updates to the anti-discrimination provisions of the Affordable Care Act, prohibiting discrimination in health programs based on race, national origin, sexual orientation and gender identity, disability, and age. These rules will help us take on the ageism and ableism rampant in the healthcare system. I'm so sorry. No, I'm almost done. But thank you. So let me close by saying thank you, SAGE, for inviting me to be here, for your work to fight ageism, ableism, and the discrimination faced by the LGBTQ plus community. Thank you to every ally in this room. We are truly on a shared mission. Your advocacy for the services and supports that people need makes community living possible for millions of Americans. Thank you, and I got through it.
Okay. Thank you, Rhonda. I'm going to offer a couple of minutes of framing remarks, and then we're going to get to the meat of our program, which is a conversation with our extraordinary panelists. And we also will save time at the end for some Q&A, both for here in the room and the event's being live streamed. And so if we have questions from our live stream audience, we'll do our best to cover them as well. I want to start by saying it's really great to have all of you with us today, both in the room and live streaming for today's exciting program. And thank you again, Rhonda, for your introductory remarks. We're very grateful for ACL's leadership and for the fact that ACL's very structure reflects the strong links between ageism and ableism. Now, in the spirit of thanks, I want to give a big shout out to Ronnie Cronick, my co-editor for the Generations Journal issue that laid the foundation for today's program, and to Abigail Harris-Culver and Brandon Stinchfield at SAGE for all of their work on both the journal issue and on today's program. There are a group of extraordinary people in this room. I wish I could introduce and lift up all of you, but I would say I do want to acknowledge and thank Kevin Williams, the chair of SAGE's Board of Directors, who is here with us today, and also want to thank Councilmember Crystal Hudson, who has been a leader on aging and intersectional approaches to our work on the New York City Council. In addition, of course, we're very grateful to the American Society on Aging for supporting and providing a powerful platform to launch this important discussion through generations, and to the Ford Foundation and Rebecca Coakley for offering us a home for today's event. In fact, an early inspiration for the body of work on ageism and ableism that we'll be discussing today came from a convening right here at the Ford Foundation back in 2019 that brought together LGBTQ plus advocacy organizations and disability rights and justice organizations to explore synergies in our respective agendas. And it became apparent during that conversation that a focus on combating ageism and advancing disability rights offered particular synergies for SAGE as an aging-focused organization with an intersectional orientation. COVID tragically reinforced the powerful synergies between aging and disability, but the pandemic also temporarily sidetracked our strategy development coming out of the 2019 convening here at Ford. But that opportunity reemerged in 2023, thanks to an invitation from the American Society on Aging for SAGE to participate in a plenary at the On Aging Conference, looking at the intersections of ageism and ableism. That plenary inspired the idea that SAGE would organize and edit a special issue of the Generations Journal focused on structural and intersectional approaches to ageism and ableism, emphasizing how these twin constructs specifically impact already marginalized communities of older adults. That journal issue ultimately brought together an extraordinary cross-section of perspectives and contributions informed by race, gender, sexual orientation and gender identity, community design and rural life, and much more. And from the inception of our work on this Generations project, we had a commitment to ensuring that the journal issue was just the beginning, as Rebecca said, just the beginning of a conversation rather than the end. And today's program reflects that commitment to continue dialogue, strategy development, and action. The body of work collected in our journal issue reflects several fundamental premises. One is that ageism is much more than a reflection of social attitudes. Like racism, gender bias, ageism is a system of awarding social, economic, and other forms of privilege. Ageism is part and parcel of the institutions and the legal frameworks that organize our society. And this structural aspect of ageism, unfortunately, is underemphasized in discussions about and advocacy on aging issues. And this lack of focus prevents many advocacy efforts from recognizing and challenging the root causes of age-based inequity. A second fundamental premise for our work and our conversation today is that ableism is an essential element of ageism. As Rhonda indicated, most people will experience one or more disabilities as they age. Many of the assumptions, stereotypes, and negative attitudes about disability mirror those about aging. And from our perspective, advocacy with and on behalf of older adults and against ageism must counter ableism in order to be effective. At SAGE, we believe that addressing the needs and aspirations of LGBTQ+ elders requires dismantling structural ageism and ableism. And we're excited to leverage opportunities like today's discussion in order to keep teasing out how to translate this fundamental recognition into strategies and actions. Now, current events reinforce that today's conversation is a timely one. We're living in a moment where there is seemingly an incessant focus on age and ability in the body politic, including prominently in this year's presidential race. In addition, recent public policy advances lift up the real difference that advocacy and strategy can make in combating ageism and ableism. For example, as Rhonda pointed and lifted up, we're celebrating an historic step forward on disability rights with the recent release by HHS of a long-awaited final rule implementing Section 504 of the Rehabilitation Act of 1973, a rule that powerfully reinforces the civil rights of people with disabilities and guarantees equal access to healthcare and human services. We're also celebrating another long-awaited federal rule, this one implementing the Older Americans Act, and among other things, designating LGBTQ+ older adults and people living with HIV as populations of greatest social need. So having provided a little bit of context, let's move into the meat of today's program, which is the panel discussion. We have here with us today 4 outstanding leaders and contributing authors to December's Generations issue. Each of our panelists speaks from different community and advocacy perspectives that can help deepen our understanding of structures of ageism and ableism at the intersections. So without further ado, I'm going to ask each of the panelists to get us started to take 3 to 4 minutes to introduce themselves and to share a little bit about why each of them was motivated to contribute to this Generations Journal issue, focused on intersectional and structural approaches to ableism and ageism. And Didier, let's start with you.
Sure, thank you, Michael. Can everyone hear me okay? Great. Good afternoon. First of all, happy Older Americans Month and happy ANHPI Heritage Month. Second, I want to echo Michael's thanks to the American Society on Aging, as well as the Ford Foundation Center for Social Justice for hosting this important and timely discussion. My name is Didier Trinh. I use he, him pronouns. I serve as the Director of Policy and Advocacy with the Diverse Elders Coalition, or DEC, as we call it affectionately. Founded in 2010, the DEC advocates for programs and policies that improve aging in our communities as racially and ethnically diverse people, American Indians and Alaska Natives, as well as LGBTQ+ people. Our member organizations are experts in the distinctive needs of the communities they represent, and as such are viewed as trusted partners in ensuring that resources, information get to their diverse communities. Speaking of our member organizations, there are 6 of them: National Asian Pacific Center on Aging, National Caucus and Center on Black Aging, National Hispanic Council on Aging, National Indian Council on Aging, SAGE, as represented by Michael here today, as well as Southeast Asia Resource Action Center, all of which are really prioritizing an intersectional approach to our advocacy and work in support of diverse older adults. I was thrilled to be offered the opportunity to contribute to this particular issue of ASA Generations Journal, mostly because, unfortunately, ageism and ableism are still extremely pervasive in our society. This despite 60 years since the enactment of the Older Americans Act and 50 years since the enactment of, as Michael pointed out, and Rhonda as well, Section 504 of the Rehabilitation Act. It's 2024, and it's appalling that we still see these stereotypes perpetuated every day in the media, in our daily lives. And so I feel very privileged to be joining this terrific panel to talk about it further. Thanks.
Hi, everyone. My name is Gelila Selassie. I am a senior attorney at Justice and Aging. My pronouns are she, her, and I specifically work on the health team at Justice and Aging, advancing a lot of like Medicaid policy and particularly Medicaid long-term services and supports, which is why if you read my article, I really focus on that. Justice and Aging is a nonprofit that's based in DC with 2 offices in California, and we provide technical support for advocates as well as advancing federal policy to improve the lives of seniors with a particular focus on seniors in poverty and those living at the intersection of multiple historically marginalized identities. I was really fortunate to contribute to this journal. I'm also a co-chair of a coalition, the Consortium for Constituents with Disabilities, and that coalition is very disability focused, as hence with the name, and across all populations. But there's a little bit of we're really much the only ones in that massive coalition that focuses on age. And we notice that a lot is whenever we're in aging spaces, we're often the only aging advocacy group. And when we're in aging spaces, there's not as much of a focus on the disability side of things. So it was really wonderful. And as Rhonda pointed out earlier, these are parallel communities, but there's also a massive intersection. It's like a Venn diagram, and that middle piece is growing and growing, growing as the population ages. All demographics are aging more and more, becoming a significant higher proportion of our population, and that is also true with the disability population. So with that, I was very fortunate to be able to contribute to the article, and very happy to be here.
Hello, everyone. Good afternoon. My name is Kylie Madhav. I use she and her pronouns, and I am working as the Senior Director of Diversity, Equity, and Inclusion at SAGE. SAGE is pretty well represented in the audience today, but for those of us who might not be familiar with the organization, SAGE is the oldest and largest organization in the country dedicated to the well-being specifically of LGBTQ+ elders. We operate along the East Coast, started out in New York, but we are now operating in many different states and forming partnerships in different countries as well. And also, so SAGE does many different things in service of well-being for LGBTQ+ elders, but a lot of our work is focused around advocacy, around direct program service provision for the community, as well as kind of essentially working with people who work with elders in various spaces to help them understand what it means to not only be inclusive of older people, but to be inclusive of older people who happen to be LGBTQ+ as well in the services that they provide to the community. And so for me, it was an absolute pleasure to be welcome to contribute to this journal because, so I approached it from the DEI angle, given my title, of course. And for me, I'm sure that we've all noticed in our political discourse over the last year or so that there's been pretty strident attacks, I would say, on DEI kind of like as a topic. writ large. And so I approach this from the perspective of wanting to demystify essentially what DEI is, like generally speaking, and then of course how we can apply that to how different organizations can use that framework essentially to figure out how to better work in solidarity with older and disabled communities. And so it was an honor to be able to put some of my theories down on paper, and I really enjoyed the opportunity. I very much am happy to be here to speak with you all today.
Thank you. Hi, everyone. My name is Sara Cantor. I use she, hers pronouns. I am the leader of a design firm called Greater Good Studio. We like to call ourselves pissed off optimists. We are focused on people-centered social change, and I'll tell you a little bit more about what that means. So for 13 years, my team and I have worked with nonprofits, foundations, government agencies, clients who are all building their piece of an equitable society. And I may be a little bit of the black sheep on this panel because I don't only focus on aging and disability, although that is a big piece of our portfolio, but we also work on public health and healthcare. We work on housing and community development, economic mobility, arts and culture, education, youth development, lots of topics. What ties these all together is that we see our mission as to bridge the gap between the people who are making decisions and the people who are affected by those decisions. Right? And so simply put, we could think of those parties as, from my perspective, my clients and our end users. And a lot separates those folks, right? There's the physical proximity that they just don't have. Our communities and workplaces are very segregated. There's also the power differential between our clients and the people they serve. So lots of ways that people are not close to each other and they don't understand. Just kind of the lived experience, if you will. And so we use the process of human-centered design to kind of level that playing field a bit, help everyone learn a bit more about each other, and in the process, bring a little more insight, a little more curiosity, and a little more equity to the process of designing programs, products, policies. In terms of contributing an article to this journal, I felt compelled to tell the story of some of our work in rural areas, as I believe that older adults and people living with disabilities in rural areas are some of the most disenfranchised and isolated people in our society. And I also wanted to write the article and join the panel because I believe that these systems, ageism and ableism, as well as lots of other isms. We've got racism, classism, homophobia, transphobia, xenophobia, right? Patriarchy, all these systems, they were designed by people, right? They were designed through a series of decisions made over time by folks in power to concentrate power and keep inequities in place. And the good news is that if these systems have been designed, they can be redesigned. And I truly believe that that is the opportunity of our lifetimes, to redesign systems of oppression into systems of liberation. I think it's possible. I don't think it's a zero-sum game. I think we can all thrive. And so that's why I'm here.
Thank you. And I hope you can already see the incredible richness and diversity of the perspectives that our panelists are bringing to the discussion today. Hopefully you've already had the opportunity to read the Generations Journal articles that were written by our panelists, but in case you haven't, or if you want to read them again, we will be emailing you after this event with a link to all of the articles, and we'll encourage you to follow up and take a look. I'm getting ready to ask some follow-up questions of our panelists, and I'm first going to direct a follow-up question to Didier. And the Diverse Elders Coalition's focus is not exclusively, but substantially on federal policy advocacy. And in that regard, I wanted to say how really pleased we are to have Ravi Rid, who is a senior advisor with Senator Kirsten Gillibrand's office with us today. And Senator Gillibrand has been a great ally and partner in this work. So thank you for being here with us today. So Didier, in your article, you make the important point that the impact of ageism and ableism on communities of color and LGBTQ plus communities can be more nuanced and more pronounced. I think it's safe to say that in this room, we all recognize the importance of intersectional perspectives in theory, but sometimes the bridge between concept and action doesn't get crossed, right? And so I wanted to ask you, can you expand on that concept and how it informs the work of the Diverse Elders Coalition. And if it's helpful, feel free to provide a specific example or two.
Great, thanks, Michael. I'm guessing that this room is already very familiar with activist Kimberly Crenshaw's theory of intersectionality, which basically states that focusing singularly on age can have the negative impact of ignoring other inequities that marginalized people from multiple identities have suffered over their entire lifetime in the way of discrimination. So we at the Diverse Elders Coalition, through the terrific individual work of our member organizations, want to make sure that we are lifting up other identities from our communities, even if our organizations may represent a distinct community in and of themselves, to try and collaborate as much as we can to highlight some of these intersectional challenges. In sort of preparing for today's session, it was actually hard to maybe just pick one example of the compounded effect and the negative consequences of being from a community of color, for example, or LGBTQ+. But I guess I settled on one that hits closer to home for me, which is what we saw during the pandemic in the way of hate crimes against the ANHPI community. I don't need to remind everyone here, but I will anyway, that there was a lot of inflammatory rhetoric, frankly, coming from the Oval Office in the White House at the outset of the pandemic, COVID-19. Terms like China virus and Kung flu were thrown around to fan anti-Asian sentiments in the United States. And not surprisingly, we saw the immediate effects of that. We saw hate crimes against Asians and the NHPI community spike, in particular for older adults and women older adults. I just wanted to take a moment to remind ourselves of some of the statistics from the first couple of years of the pandemic. You may be familiar with the organization Stop AAPI Hate. They were really at the forefront of lifting up these tragic incidents that were occurring in real time across the country. But they reported nearly 11,000 hate incidents in the first 20 months of the public health emergency. More than 1 in 5 Asian Americans experienced some form of hate incident as recently as 2022. Between 2020 and 2022, nearly 8% of hate incidents targeted Asian Americans 60 years and above. And I think this was the most alarming to me, is that those who were 60 and above were far more likely to experience physical assault than those under the age of 60, by a clip of 26% to 15%. And I think this plays into the stereotypes, many stereotypes. One, obviously, ageism, that older people are more vulnerable, more fragile, easier targets, especially for physical assault. But it made me think about those who are not yet older adults, including myself, and some of the stereotypes that I grew up with, the model minority myth, right, where Asians are viewed as being less vocal, more submissive, less likely to report an incident. And sadly, some of this is true in terms of what the numbers bear out, which is that they are, especially Asian American women, are far less likely to report incidents because of the repercussions of feeling as though they'll be targeted additionally, even in some respects by law enforcement. So I raised this particular example because I have immigrant older adult parents who, like many others, were managing the pandemic as best they could. They live in Michigan. I'm based in DC, so I'm a long distance caregiver, which meant that I obviously couldn't be there with them on a regular basis. But as more of these reports surfaced in the media around anti-Asian hate crimes, they had, as a precautionary measure, had rescinded their gym membership. And so were left really to just walk around their neighborhood as a form of physical exercise and physical activity. And they became much more apprehensive about leaving the house. And they live in a suburb with a smaller NHPI community, but understandably, they felt like they had to look over their shoulder. And by my perspective, it's a pretty safe neighborhood, but those fears become very real. And so I wanted to highlight that example. Also wanted to highlight another example, which is the rationing of care during the pandemic. Obviously, the demand on the healthcare system was exponential, and there was a limited amount of life-sustaining resources and devices. And so, shockingly, entities and hospital systems decided to introduce age-based criteria to determine who and which patients got care, which left older adults and oftentimes older adults of color at higher risk of not receiving care. They basically had a standard for survivability, long-term survivability, which then, of course, made, I think, the emergency aspect of care, which really should have been focused on short-term survivability from symptoms of the virus, again, causing many older adults to be left by the wayside. So I'll stop there, but those are a couple examples that really resonated with me.
Yeah, thank you, Didier. I think it's so important to lift up, right, COVID and that powerful mix of so much of what was going on. Galila, your article talks about legal structures that effectively codify ageist and ableist views. So, example, the Medicaid statute effectively pushing older adults and people with disabilities into skilled nursing and in nursing homes, and that we need a more systematic approach to legal redress in place of the patchwork legal systems that exist now. I wanted to ask you, do you see opportunities for a more systemic approach on the horizon? And in the meantime, how effective is the patchwork that we have now?
Yeah, I did a very deep dive into the Medicaid statute because Medicaid is my life. And I think when we talk about systems of oppression and, and having these like systemic biases embedded, I think that is one of the clearest ways, at least in my area of expertise, is that when the Medicaid statute was enacted in 1965, it was really intended for you either hospitalized in a long-term care facility or you're in an outpatient clinic and nothing in between. And that was really troubling because it never even, and you can imagine in that era, especially the stigma against people with mental health disabilities and being put in these horrible institutions. And it was really seemed as if being institutionalized was a fact for the disability and aging communities. And it wasn't until many decades later, over time, the Supreme Court decision, Olmstead versus LC in the late 90s, I think it was late 90s, yes. Those were really the ones that made a huge impact to try to move away from this idea that you have to be institutionalized for long-term care. With that said, how effective is the patchwork? On a high level, one of the challenges is that even though we have a lot more home and community-based service programs. There's rebalancing initiatives where more dollars are being moved away from, more Medicaid and Medicare dollars are being moved away from institutions towards home and community-based care. We have, a trillion new regulations that just came out that are really advancing access to home and community-based services. But I think it is all still built on a very fractured foundation because, again, the Medicaid statute does not provide for mandatory access to home and community-based services. So even though we do have these great initiatives that are ongoing, I think that foundation just has to be rebuilt in a way that actually prioritizes community integration and autonomy first, and as the sort of presumptive form of care, and institutions as a sort of alternative form of care, under certain conditions, because that's what overwhelming majority of older adults and people with disabilities want. On a sort of more policy wonky level, another challenge with the sort of patchwork of systems is that, as I mentioned earlier, these communities, aging and disability communities, have unique services. And as the HCBS program exists now, they're administered through waiver population, which is great in the sense that certain services can be sort of tailor-made for a particular population. But of course, not everybody fits in this tiny little box. And so if you have, for example, someone with a developmental disability who's receiving things like vocational support, employment support, things like that, well, that person is going to age. And as they age, maybe they need a little bit less of that once they're around retirement age, but they might need some of the other services, some of the other therapies and skill sets and things like that that they're getting from that waiver. And maybe they want to get that and would do best to get that in an adult day center for older adults and be among their peers. And it's really challenging to be able to do that sort of cross-waiver services. And so that's sort of a more granular example about the challenges of the patchwork system, in addition to just the fact that when it's so all over the place, when it's so specific to a state or a waiver population, it's much harder to develop like great quality of care standards or to provide any kind of like equitable data, because of course you have to have kind of a baseline. And so when we're looking at like different populations that are receiving more or less care, that's again really hard to do when everyone's kind of doing their own thing. Now, I'll try to be optimistic, even though I'm very much a pessimistic person, is that there has been increasingly more bipartisan support from Congress for Medicaid, as bipartisan as it's possible to be. And especially for the home and community-based services programs. And so I think that I'm not optimistic that we're going to like completely revamp the Medicaid statute and make HCBS mandatory overnight, although there's a couple bills that have been proposed in the last couple of sessions that would allow that. But there are efforts to make it easier for folks to get that. And as I mentioned, we have great administrative regulations to support that. And I also wanted to put one more plug for one more regulation that just came out regarding nursing home staffing. And the reason why I raised that is that there is we love HCBS, we definitely want HCBS, but nursing homes, as we've seen during the pandemic, have just been like death houses for older adults. And there's a huge correlation between staffing and race. So we wrote a paper a couple of years ago that found that, and looked at several studies, and one study found that nursing homes that were disproportionately Black or Hispanic had significantly lowered registered nurses. And that particular study accounted for other factors, insurance status, region, everything like that. And the only correlation they could find was race. And so what that means is more falls, more hospitalizations, bed sores, infections, and even mortality. So with this nursing home staffing rule, that helps to make things a lot more equitable with the hopes that people are around long enough and can survive these nursing homes so that they can maybe transition to the community if that's what they want to do. So yes, I think that's it for me.
All right, thank you, Galila. We're going to switch gears a little bit. Sarah, we're going to question for you now. I love how your article makes this really powerful theoretical statement that human-centered design challenges the status quo narrative of ageism and ableism, and how it really demonstrates it specifically. And I'm thinking about your illustration about bus systems was just fascinating. Can you say more from your perspective about how human-centered design gets us from the theoretical to the specific in confronting these issues.
Yeah, thank you so much for that question. Thanks for reading my article. So often when we start out with a problem to solve, we've got data. And we've heard some data just now about different challenges, right? We've got food insecurity in our community. X percentage of seniors are perhaps accessing SNAP benefits or maybe not accessing SNAP benefits. But what we've noticed is that when we stay at that high level, surrounded by the data about the problem, we sometimes feel overwhelmed, we sometimes feel stuck. In those moments, sometimes we will look to best practices, we'll look to other policies from other communities or other countries, we'll look at research studies, et cetera. The one place that we don't often look is to the actual people experiencing the problem. So human-centered design is all about asking this question, why? Very simple. Why is this problem happening? And can we get closer to the problem in order to understand it better? Because chances are we might see the problem, we might have all the proof in the world that it's happening, but we don't always know why. We don't always know the root causes, right? So I'll share a little bit just about the example that Michael was referencing. My team was working with a group of local leaders in North Carolina, in a rural area in Appalachia. The project was a Robert Wood Johnson Foundation funded project focused on community health. And this group of local leaders was really focused on healthy eating and food security in their community. It was a low-income area. They described it as a food desert. And in order to understand this issue on that more human scale, we encouraged our design team, our client team, to go and recruit some neighbors and some folks in their community to shadow, to basically spend time with and talk to them about meal planning and grocery shopping and eating. Like, how is that actually going? So one of the team members, her name was Greta, she worked for the local housing authority. And so she recruited one of her residents and they were gonna go shopping together. And Greta said, great, so I'll meet you at the store. And April was her name, said kind of famously to us now, she said, no, you'll meet me at my bus stop. So these two women met at the bus stop. This is again a rural space. And it took them 90 minutes to go 1.5 miles. Okay, the route was obnoxious. At one point, apparently the bus driver actually pulled over, got off, and took a smoke break. Like that was how little regard there was for the passengers on this bus. And for April, this was just sort of like this is my routine, this is what I do, this is what I deal with, this is how I get my groceries. And Greta was like shocked and appalled and kind of realized that okay, so I get that healthy eating isn't a matter of just individual education or social supports, but there are these structural barriers, right, to access. And it's somewhat about transportation in this case. So long story short, and I won't go through the whole process, but they did some community brainstorming, they launched some pilots, and a couple years later they had Wilkes Fresh, which is a mobile food market in their community. It's still going, it's very successful. They also did some things that were a little bit more systemic, like they changed the transit schedules. They actually implemented something called a reverse route. Amazing. And April's ride now takes less than 10 minutes because she can just go the opposite way instead of going the slow way. I guess one thing that I just want to say is that moving to the specific doesn't necessarily mean staying there, right? We have to go there, but if we're working on programs or we're working on policy, we have to generalize. We have to come back out. But I believe there is universal truth in the individual stories. And if we can hear those individual stories, we can hear dozens of them or hundreds of them, or in some projects, thousands of them. We can synthesize those patterns across lots and lots of individual stories, and we can uncover the root causes and say, where would our intervention make the most difference? So that's, I think, how we make human-centered change to systems.
Fantastic. So interesting. Kylie, in discussing an anti-ageist and anti-ableist perspective, you write in your article from an organizational perspective, right? And more specifically, you write, I'm going to read a quote that I loved from your article. Focus on systems, not just minds. To ensure maximum impact of any equity initiative, there must be systems in place that clearly define and incentivize equitable behaviors and praxis. I wanted to ask you, how do you see that approach that you're describing playing out in your work at SAGE?
So thank you for that wonderful preface. And a lot of what I'm going to say right now is actually kind of building off of some points made by my esteemed co-panelists here, especially Sarah's point about kind of focusing on systems. But before getting to that, so there's a few sort of base core beliefs I have that inform the way that I approach DEI work. One is that you have to be very specific about what you're looking to solve for, right? So in the case of an organization like SAGE, right, like we are at this point 46 years old. I'm doing bad math in my head, but I'm about 46 years old at this point, and we have staff operating truly across the country and in different geographies around the world at this point. And even though we all work under one umbrella, we do very different things. And so that is something that I've been very cognizant about, is that I think that just in general, this is at SAGE, this is elsewhere, that DEI work, especially at an organization that is as multifaceted as SAGE is, you want to be taking a team-centric approach, right? Like there, of course, should be certain organizational guideposts that help kind of, that help, I guess, like level the playing field, as it were, in terms of this is where we stand on this and that. But in terms of actual practice, I approach it from a team-centric approach. So with that being said, as I mentioned earlier, you have to be very specific about what you're solving for. And one way that I kind of take a systems-based approach in starting at the assessment phase is when we're looking to essentially figure out what the it is or what the what is in terms of DEI practice at SAGE, I've really wanted us to make sure that we're asking the right questions, right? Because, I think, again, a lot of DEI work, I think, just in the space is often based around feelings and emotions, which are valid, of course. But I want to actually get to a way where we're able to the extent possible, identify, comparable change in attitudes about a particular topic, be it race, be it gender, be it age, ableism, so on and so forth, right? And so this past year, we actually worked for the first time with an outside organization on our annual staff survey, where they essentially have kind of a science-based approach of like, here's how we actually assess for racism. Like, and of course, there's, and not just like racism, but like any sort of ism or phobia. And of course, like a lot of that is based in, is like, there is some kind of subjectivity there, right? So it's not a perfectly objective system, but essentially what we were looking to do was not ask people, do you feel that you have been, for example, this is not an actual question that has ever been asked, but just for example, do you feel that you are having a less positive experience at SAGE based on quality X? Some people might say yes, some people might say no, but that doesn't really tell you much, right? That's like asking someone, are we friends, as opposed to asking them, if I was in X situation, would you actually show up for me? Something like that, right? So that's kind of, that's what the approach that we took in the assessment phase. And I feel like it's really important to be very kind of systematic about what you're assessing for, because again, DEI work can very quickly go off the rails if you don't really have a focus, right? So there's that. And then beyond that, right? So, and this is just citing an example of one team that I've worked with, right? So we have our HR team at SAGE, of course, like many other organizations do. And so one project that I worked with them on, as pertains to kind of like a system-based, like how to systematize DEI work, right, is looking at how we're recruiting and where we're recruiting, and also like trying to move away from kind of gut feelings in the assessment phase, right? So, if we're like, again, this is not per se what was happening, but in general, organizations, if we rely on our kind of networks for talent acquisition, right? Well, our networks, because we do live in a country where the legacy of segregation is still very much alive, quite frankly. So our networks tend to often look like us in different ways, around different parameters. And so if we're only relying on the networks of the people who already work in an organization, it's not really an effective way to, diversify the talent pipeline, as it were, or to bring different constituents to the table from a programmatic perspective, right? So I worked with that team to kind of like figure out, like, one, how are we doing outreach essentially, and then two, kind of like once we're in front of people, what are we actually looking for, right? Is it just because, again, gut feelings will often lead us to feel more favorable about people who we can see ourselves in, or communities that we can identify with. And that often leads to essentially the kind of opposite outcomes in terms of what we're looking for from a DEI perspective. And then so kind of beyond that as well, in terms of the policy creation piece, again, like I think that Sarah touched on this beautifully, but we don't, right? So most people who are like creating policies, no one thinks that they have a bias, right? Like we often don't know what we don't know, and we all think that we're perfect people who are devoid of biases, and surprise, surprise, we're not. Like we're all human beings in here, right? And like we all have our limitations and our perspectives, and that's actually okay. That's actually not what I'm looking to kind of solve for in DEI work. I'm just like looking so for example, from the policy perspective, I'm looking to make sure there are robust mechanisms for hearing the voice of people who we're trying to build policy for. So when it comes to ability status, to ability or to age, I want to make sure that when we're building solutions for people who are affected by these policies, that we actually are hearing from them. And so that's, again, just one example of kind of like how I've approached this work at Sage. I'll pause there.
Okay, thank you, Kylie. And I have a burning follow-up question, but we committed that we're going to make sure that there's an opportunity for burning questions that you all may have for the panelists or folks who are live stream as well. And so, and I have additional questions that I can absolutely ask the panelists if there's time. But let's stop for a moment and see if anybody who is live streamed has a question. Why don't we start with that? And then we will see if we've got somebody in the room might have a question as well. So Sam, do you have a question that you'd like to?
Sure, yeah. So an anonymous attendee wrote for the whole panel, although there are common experiences between the aging community and those with disabilities, there are also differences for those who have lifetime disabilities. One example is the lack of ability to buy long-term care insurance. Can we have a conversation about how these are different?
That's an amazing conversation. And who would like to comment on that?
The healthcare nerd will start on that.
Go for it, Galila.
Yeah, that is a great point. And just as a disclaimer, long-term care insurance, because we focus so much on seniors in poverty or close to the poverty level, long-term care insurance is often very expensive. But with that said, it all goes back to the system of like not having a robust infrastructure and a robust care program to provide for the aging population, as well as those with who have disabilities at an early age. Again, the default is pretty much to put people who've had these lifelong disabilities in something close to institutionalized care. And so that's one of the problems. And one factor with that, and one reason potentially why long-term care insurance is so expensive, is because it is more expensive to institutionalize somebody than for them to receive care in their own home or in a community-based setting. And so it really just baffles the mind why the system is in place. And it's not something, our executive director was recently in, I believe, Germany it was, and looked at their aging infrastructure and how they provide for their older adult populations. And their system is entirely rooted in the family, which is really interesting because I wouldn't expect Western Europe to have a very strong like intergenerational support. My family's from Ethiopia, and that's something that we have in East Africa. But apparently that's what it's rooted in, even though it's not as obvious. And then it's rooted in the family first, and then it's rooted in sort of the clinical medical part second. And so that kind of like social familial model is really interesting because it makes the idea that like insurance, social insurance, or private long-term care insurance is like the addendum to providing this one specific type of care they might need specific to whatever supports they need. But they are humans in the house first, and they have family supports first and respite care for family members first. And so that sort of model helps keep costs much more reasonable, and then also just provides more dignity for that population. So I don't have a great insurance explanation for why long-term care insurance is terrible, other than just the fact that the system that it's based off of is incredibly expensive and just very limited in terms of what someone can receive.
Great, super helpful. Is there anybody else on the panel that wants to comment on that before I go to the next question?
Just maybe to offer a parallel, which is that the federal government has a handful of agencies that support older people and people with disabilities, which is good that there are benefits and services available, but not so good in the respect that they tend to cater to an overlap as opposed to being more tailored to the unique needs of those with disabilities versus those who may not have a disability. As an older person, Social Security, Medicaid, Medicare, those are basically your three options for getting services at the federal level. And so I just want to make a plug for data collection as part of this, because it's only through the collection of more and better data that is disaggregated accordingly by identity, by subpopulation, by sexual orientation and gender identity, that we are able to design programs that better serve the needs of everybody versus, again, three large agencies that try and do everything for everybody.
Thank you for lifting that up, Didier. Anybody in the audience at this point have a burning question you'd like to ask? Hannah.
Hi, Hannah. Hi, thank you all. I'm Hannah, she, her from Sage. While you all were talking, I was thinking about, obviously, all of the great examples you gave of intersectionality and how one of the great things about the disability community is how effectively they've been able to work in coalition with people across borders. And so, of course, this was realized most clearly through the Convention on the Rights of Persons with Disability, which, you know, the US became a signatory to in 2009. That is lacking for aging populations. And so the aging movement across borders is a bit more nascent at the moment. I'm curious to see how in your own work domestically you leverage the obligations enumerated under the Convention on the Rights of People with Disabilities, both for people with disabilities and perhaps even for older adults, because I think that's a specific learning opportunity for us at the intersection of ageism and ableism, both here and abroad.
Sarah, somebody on the panel that would have a thought on that question? Does that come up and
Sure, I have a thought, and it's a fantastic question. I think it reminds me of the very first executive order that was signed by President Biden back in 2021 around advancing equity. Great that this was the very first executive order he decided to sign. B, not so great because it focused on structural discrimination against communities that we're all familiar with, right? So by race, by ethnicity, disability, geographic location, those in rural areas, LGBTQ+. And I think it was a missed opportunity to highlight aging populations and ageism writ large. And so my hope is that the feedback has been provided. You know, I think ageism has to be looked at and thought of by policymakers as a structural problem and should be included in all of those classes that were explicitly laid out as part of its executive order.
And Hannah, I think one thing you're lifting up for us as we advance this conversation moving forward would be that it would be interesting to look more at that global and international perspective and how, you know, how folks doing this work have been able to lift up those kinds of protections and where there might be opportunity to the extent that that's not happening to advance that. We have another, before I go back to pitch my next question, do we have another burning question in the audience for? Okay, I'm gonna ask. You know, as folks know, my guess is that many of you have been on panels in the past, and you know that we prepare for these things and we talk about the questions we're going to ask. And I'm going to go a little off script here and ask a question because something that you said, Kylie, just really struck me in terms of its implications for the work that we do, and that was when you were talking about the notion that often people's greatest comfort zone is in interacting with people who they can see themselves in, right? And I think about the fact that as, thinking about SAGE's experience, but I know it's not in any way unique to SAGE, right, is that we are an organization that works with and on behalf of older adults. And what that means, we know statistically, is that the majority of the people we work with are people who are living with or have lived with or will live with a disability. And as is the case in most nonprofits, most of our staff and most of our volunteers are not older adults, are people who are significantly younger than our constituents. And most of our staff and volunteers are not people living with disabilities. So I'm curious, I wanted to start with you, but I also thought, Sara, you might have thoughts as well, or others as well, is how does that dynamic that you were describing play out, and how do we mitigate for that, right, in ensuring that, say, an organization like SAGE does not self-replicate ageism and ableism because of this very natural and human dynamic that you were describing. So it's a little bit of a curveball because we didn't talk about that question before, but I can't resist. And then we'll love it if Sara or anybody else has thoughts about that as well.
Thank you for the question. I'm never opposed to a bit of freestyle, so no, for sure. But I think that goes back to kind of like what I was mentioning earlier in terms of systematizing how we assess for talent and how we assess for potential, right? Because I think that Michael alluded in his opening remarks to the relatively unchecked entrance of a lot of specifically ageist and ableist rhetoric into our national dialogues around politics these days. It's almost inescapable on across outlets and not even addressed, right? So I think that how we make sure that we're not, unintentionally and, ironically, like replicating systems that we're looking to dismantle is making sure that we have a robust system in place, which I do think that SAGE is like leading on in terms of how we assess for talent, right? It's like it's the difference between saying, we're looking for someone who has, X number of years in X role and saying we're looking for someone who can do this, full stop, right? Like, can you do task X, right? So like focusing on the work itself as opposed to the pedigree or the background or like whatever the route might be that's gotten you to the work. I think that's one strategy that I've discussed internally with our team, but I think it just comes back to that, making sure that, SAGE specifically and all of our organizations just have very specific ways to get at what we're looking at with as little conjecture as possible, as it were, with as little room for gut feelings and hunches as possible.
Interesting.
Yeah, I have thoughts. So I chair a nonprofit in Chicago called the Jewish Council on Urban Affairs. We work on police accountability, community organizing alongside many other groups in the city. And the trainers at JCUA talk about 3 zones. They talk about the zone of comfort, which is when you're like in your sweet spot, everything's good, you're learning things that you kind of already know. Outside that, if you can imagine like 3 concentric circles, is the zone of growth. So maybe there you're learning things that you didn't necessarily know before. Maybe they're even challenging some of your worldviews. Beyond that is what they call the zone of panic. So like, oh my gosh, this is changing everything I thought I knew about the world. I'm uncomfortable, I can't learn, I can't handle this, I have to go home. And in their trainings, they talk about we need to stay in the zone of growth because we can't stay in the zone of comfort. And I believe that, if we all stay comfortable, we're never going to move beyond the status quo. Certainly, our clients hire us in part because they want to understand better the people that they are serving, who they recognize that they themselves are often not. That said, every project of ours has what we like to call a reckoning, which is a moment where our clients or the people they serve kind of realize, wow, we're really different. Like we're more different than we thought, and actually maybe that's making us feel a certain way. And I think that the intuition or the insight that people are often comfortable with people who they are they see likeness in is both true and only gets us so far, because I might look like you and that might be like an initial way to bridge a connection, but there's so many ways that we all share characteristics, not to get super woo-woo, but I think it was Rebecca who said, it's not about independence, it's about interdependence. I feel like that was the line of the day. And helping us all to understand that, like, actually, yes, we are different, but we need each other. I can't grow if I'm only staying in that zone of comfort. So that's what we talk about.
Great. Super, super helpful. Thank you both. Thank you both for that and a little bit of freestyling. And we've only got about 10 minutes left. So I'm going to ask a question, and that I invite folks. Any of you can either respond to the question if it inspires you, or if there's something else burning that you've got in your mind that you haven't said yet that you'd like to be able to share, we encourage you to do that. But the question that I wanted to ask is that, obviously the interplay, right, between ageism and ableism is a recurring theme in the journal issue that we worked on together. And I'm wondering if, from your experience and work, if you've seen examples of how recognizing the intersection of the two actually has helped to craft effective solutions that advance equity. So if that's a question that inspires you and is something you'd like to address, please respond to that. If there's something else that you really, really want to share before we wrap up, respond to that as well. So I'd like to,
I'm happy to jump in, Michael, and maybe turn that question on its head a little bit, because I think there's more of a failure to recognize that intersection, especially in the policymaking arena. For those of you who did read my article, there was a part of the article that centered on what Kylie was just mentioning, the issue of ageism and ableism in the national discourse, but in particular in Washington, D.C., where we saw it play out with Senator Dianne Feinstein of California, the late senator, who was being criticized for not fulfilling her duties as a senator. Senator John Fetterman of Pennsylvania, who suffered a stroke and was criticized for having certain accommodations to fulfill his duties as senator. And of course, the ongoing age discussion with our presidential candidates. I think it's a real shame that if you look at the United States Senate, half of its membership belongs to the older adult population and demographic. And yet, politically, they view it as a liability to talk about their age because they want to get reelected and they want to maintain their incumbency. And yet, if they turn this question on its head and actually spotlighted the fact that they are effective members of Congress in the highest institution of lawmaking in our country, working on a daily basis on behalf of their constituents, imagine what kind of ripple effect that would have on voters, on the general public, if instead of running away from that question of age, they put it front and center and showcased the work that they're able to do every day on behalf of Americans. Now, we can argue about the quality of the work. That's a separate conversation, but at the end of the day, we actually have a target audience in Congress that could be champions for aging with dignity, aging productively. And so that's sort of my take on your question, Michael. To answer your question more directly, I do want to applaud the Department of Health and Human Services, ACL. I think it was very smart of them to release a litany of final rules, as has been highlighted today. Section 1557 of the Affordable Care Act to restore and strengthen anti-discrimination protections that were undone by the Trump administration. Section 504, which was the first major update of the Rehabilitation Act in 47 years. I think it was very, very smart to package them together, as well as the update of the Older Americans Act earlier this year, because it's it's great that we are improving those laws, but I think equally important is ensuring that they're being applied consistently across ageist and ableist perspectives. And so I just wanted to end on a more positive note.
Thank you, Judy. Well, folks, Galila?
Yeah, if I can sort of continue the policy trend and also turn that question on its head a little bit. I agree with all of Didier's wonderful points. One thing that I'll note that has been very frustrating is that the powers that be very often pit aging and disability communities against each other when it comes to providing resources, providing supports of different kinds, and pit these communities, our communities, against others, against low-income families, against single parents, and just the gamut, against immigrant populations. And it's really a tool of white supremacy to have people fighting over scraps and hoarding resources instead of trying to make an equitable system for everyone. So I guess my big takeaway is just to make sure that we really do demand that all of our communities, everybody's going to be aging. Significant portions of the populations will have disabilities if they don't have any now, or have a loved one who's going to have a disability if they don't have one now. And so there's really no need to try to act like these are completely separate groups. There was a hearing by the House Energy and Commerce Committee last week on a litany of Medicaid bills, and the narrative I kept hearing that drove me insane was we need to make sure that Medicaid is available only for those who really deserve it. And it's infuriating because one, it's healthcare, and everybody needs and deserves healthcare. And then two, the implication is that, oh, not everyone needs it. And you can probably kind of guess what the dog whistle subtext of that is. And so that kind of narrative, we really can't allow, even though it's become significantly more mainstream, and for some reason it's just been allowed. So that's my big takeaway, is just make sure we're not pitting ourselves against others as we advocate for the aging and disability communities.
Thank you for that, Galila. We've got 7 minutes left, and so I'm going to ask each of the panelists if there is a final remark that you would like to share as we wrap up. And why don't we start with you, Sara, and then we'll work our way down the group.
Yeah, thank you. Well, this has been phenomenal. I've learned so much. I hope it's been educational for others. I guess what's kind of sitting with me, I know it was something that we talked about initially, was just this idea of well, should we focus on systems or should we focus on mindsets? And I don't think that's a binary, right? I think you need both. And ultimately, we want to be focusing on root causes. And some might say that the systems are the root cause, and then the mindsets and the biases and the discrimination are just sort of a symptom. But I could also see it being argued the opposite, that actually it's the attitudes and the biases that are the root cause, and the symptoms show up in our policies and in our programs and protocols. I don't think I don't think it matters where we start and where we end there. But I think that something that I'm kind of taking away is just this idea that it's not an argument against narrative change, but it's an argument to add this sort of systemic lens to all of the work that we do. And designing systems is hard. You got to get the right people in the room, and you've got to make the invisible visible. And sometimes we can't tell where a system starts and ends, and where a human, individual actor might show up and create bias. But I think making systems visible and tangible is kind of how we start to dismantle them. We have to see them first, and then we can work on them. So
Great, thank you. Kylie.
Absolutely. So thank you all again for being here today. I'd like to kind of just end by picking up something that my colleague Galila just mentioned here in terms of when it comes to ageism and ableism, right? So there are certain groups that we belong to and certain that we won't ever belong to. But, given, if the assumption is that if a person is on this earth long enough, they at some point are going to age. Well, we're all aging all the time, but and most people, given enough time, will experience a disability, be it permanent, be it temporary, and so on and so forth. And I just think that that's a really important point to kind of bring home for our policymakers, but also for ourselves, like when we're designing policies, programs, systems, so on and so forth, right? Just like think about, would what you're proposing be acceptable for you, right? Like would that afford you the dignity that you're looking to have to live with when you're X age, or if you should have X disability? And if the answer is no, it's not good enough for me, then it's probably not good enough, right? So don't, like, just like this is a unique sort of kind of area where we actually can see our, like, insert ourselves like into the conversation, because again, if we're here long enough, we are all going to age. And so it's just really important to just like keep that in mind. Like if it's not a solution that would afford you the dignity that you deserve, then it's not good enough for anybody else. And so don't propose it.
Thank you, Kylie. Galila.
Yeah, I think I've said everything profound already that I have in my tool belt. The only other thing I will say is that when we were talking about Section 504 earlier, the final rules that were just published, 504 came to be because a lot of disability advocates, like stormed federal buildings and sat outside and did these sit-ins in order to get this incredible law passed, or to get this incredible regulation. And I think that self-advocacy piece is so important. Whether there was this something said earlier that older adults don't need to be empowered; they already have power. And that self-advocacy tool that the disability has used beautifully for decades really needs to be applied for older adults. So just making sure we give that power to older adults.
Thank you. Didier, last word to you.
Galila gave me the perfect segue to one final thought that I had, which is maybe a homework assignment for everybody in the room. Please, no boos or hisses. But I think self-advocacy can play out in all of our lives in our own ways. It doesn't have to be to policymakers. It can be to our friends and relatives and neighbors. I've really tried to call out ageist and ableist comments, jokes, whenever they occur, because they happen all the time. Birthdays. Oh my gosh, I'm getting old because I'm sore from going to the gym yesterday. It's that insidious repetition that frankly just perpetuates the way society views these issues. So I would encourage you to gently and politely call people out when they say those things, because that's how we can affect behavioral change in our own ways. It doesn't have to be, in front of Congress or in Washington, D.C.
Great, thank you. Well, please give our panelists a round of applause, and thank you all for this great discussion. I want to thank you all for being here. Thank the folks who have live streamed in with us today. And as I mentioned at some point during the conversation, we will be emailing out the links to all of these articles, and we'll be looking for ways to advance this conversation, advance this work, advance strategies at every level, at the policy level, at the individual level. So thank you so much. Bye-bye.